Emily Richards. I'm excited to be your host for the live show. We've got a great show lined up. We'll be talking with Dr. Kumar Vadivel, also known as Dr. V. He's a super smart dentist who knows a lot about teeth. He's going to tell us about the newest things in dentistry and how to keep our teeth healthy and ways to get dental care that does not cost too much. Whether you know a lot about teeth or you just want to learn about how to keep your smile bright, you'll find something interesting here. We'll cover many topics like why brushing your teeth is important and what's new in dental technology. We've already got some questions from you, our viewers, and we'll answer them. Plus, you can ask more questions during the show. Before we start, let me tell you more about Dr. V. He's not just any dentist. He's a periodontist, which means he's an expert in certain types of dental care. He works at ToothHQ Dental Specialists in the Dallas-Fort Worth area here in Texas. And guess what? He's even writing a book that's coming out this year. If you want to know more about Dr. V, check out our website at www.mytoothhq.com. So let's get comfortable and ready to learn lots of cool stuff about taking care of our teeth. Let's begin our dental live show and welcome everyone. And now let's welcome Dr. V and start our show.
Thank you, ma'am. Appreciate it very, very much. Hi, everyone. I'm Dr. Kumar Vadivel, as you guys know, but you can call me Dr. V, as all my patients do. I'm really excited to be here with you all today again. Let me tell you a little bit about myself. I'm a board certified periodontist, which means I'm specially trained in taking care of gums and bones that support your teeth. I'm also skilled in dental implants and oral surgery. I'm part of the American Academy of Periodontology and the American Board of Periodontology. That is just a fancy way of saying I work with a group of dentists who are experts in gum health. I started ToothHQ Dental Specialist, and we have 4 locations, as you guys know, in the Dallas-Fort Worth area in Texas. We are all about making sure that your teeth and gums are healthy and strong. Now, I'm here for you. I would love to hear any questions you might have about your teeth or gums. You can ask your questions live here right now, or even send them for our next show. Your questions help us make these shows really helpful for not just you, for everyone who's watching the show and the world around you. And one more thing, if you like what you're learning here, I'm sure you will. Please let us know. Your feedback is super important to us. And
Yes.
don't forget to like and subscribe to our channel so you won't miss out on any latest updates and helpful tips about your dental health. I'm looking forward to another great show talking with you and answering your questions, and let's make our smiles the best they can be, right?
Thank you,
Let's
Dr.
get
V.
started. Yeah,
That's
awesome,
wonderful.
awesome.
Alrighty. Let's see, Dr. V. So we have some wonderful questions here from our viewers. So let's get started with talking.
Mm-hmm.
All right, Dr. V. So, hello, Dr. V. I have a few questions for you. Number one, can I get a partial denture if I have periodontitis? Can I get a general cleaning twice a year before undergoing a deep cleaning? And then number three, why will I be approved for regular cleaning for gingivitis when I really need deep cleaning with antibiotics costing $870 out of pocket?
Great question. Multiple questions, of course, right?
Mm-hmm.
So let's break them apart. So, can I get partial denture if I have periodontitis? Um, the answer is yes, as long as the gum disease is under control or the periodontitis is under control. When you have active gum disease or active periodontal disease, if you are going to get a partial denture, as you know, the partial denture is just going to sit on your teeth And this is the way the partial dentures look right here. And if you are going to have them sit on your teeth when you have active periodontal disease, when your teeth are already loose or getting loose from the gum disease, and they will make them even looser, and you will end up losing your teeth even faster. So to answer your question, yes, you can get a partial denture, but after you get your gum disease treated or periodontitis treated and your teeth become stable. Part two of your question is, can I have a general cleaning twice a year before undergoing a deep cleaning? The answer is yes. Um, I'm thinking that you're trying to get by because you're trying to postpone your deep cleaning. I would rather have you get something better than nothing. So at least get a general cleaning, although we are technically uh, although technically we will not recommend you get a regular cleaning. What you want to get, either we call it as a full mouth debridement or a deep cleaning prior to you go undergo what we call it as a periodontal maintenance or your regular cleaning. So the answer is, I highly recommend you consider getting a deep cleaning to get your teeth stable, because you need a partial and you don't want your teeth to get loose. And you can get a regular cleaning or a maintenance cleaning after you get your deep cleaning. So now the part three of your question, why would I be approved for a regular cleaning for gingivitis when I really need deep cleaning with antibiotic costing about $870 out of pocket? So I am assuming that you have some dental insurance and you want to use the dental insurance towards getting this periodontal treatment done, which is the deep cleaning that you're referring to. And your question is related to, why would the insurance pay for a regular cleaning when you really need a deep cleaning? Well, the dental insurance is in the business of saving money. So
Yes.
if a dentist is willing to do a cleaning, or even from on in the defense of the insurance company, as I said earlier, they would rather have you get something than nothing. So they are probably approving it, but it will be in your best interest, and forget about like the dentist doing the cleaning or the insurance approving it, in the best interest of you in terms of saving or saving your teeth, or even saving you money long term. I highly recommend you consider getting the deep cleaning as soon as possible instead of thinking about it, right? If you're determined to get the deep cleaning, why would you even want to think about it, right? So if you have concerns about saving money, then just keep saving money and get it done as soon as possible so you can help save your teeth and get the partial you need and help keep smiling.
Yes, Dr. V, I couldn't have said it better myself.
Yeah, perfect.
Very wonderful answers.
Thank you.
So we do have another question for you. So this person is asking, it says ToothHQ Dental Office, could you please provide me with an estimated cost for the all-on-4 procedure?
So the cost for the all on four procedure, it kind of varies. Sometime the term all on four or all on X kind of get loosely used, and people get a misunderstanding whether it is a removable all on four or a fixed teeth all on four. Most of the time, all on four refers to what we call it as a fixed teeth on 4 implants or fixed teeth on 6 implants. For example, this right here. So a regular denture, as most of you guys might know, they just have a tendency to come out like this. So the teeth, and imagine this is the gum and this is the teeth, so they come out.
And they have
So
a palate as well,
that
right?
is correct. Yeah, they do have a
Yes.
palate. Good point. Yeah,
Yeah.
so they do have a palate. As opposed to when patients have an aversion for not being able to tolerate this regular denture, they can get something like what we call it as a snap-on, again with no palate. Again, you get 4 implants, one, two, three, four, and then you snap it on. But this one does not have a palate, but it is still removable. However, the all-on-4 is something that is totally fixed. As you can see, again, there is no palate, and this does not come out. And all these fixed teeth that we are talking about is done on 4 implants, and that's what is called as an all-on-4. The cost of that is can range anywhere between about 17 to $20,000 all the way up to $30,000. The cost depends on whether you are a candidate for an all-on-4, or whether you have some advanced bone erosion, and that will not make you a candidate for an all-on-4. So then you may need some advanced dental implants done. So that's how the cost might differ. So to answer your question, to do an all-on-4, it is going to cost you anywhere between $20,000 and up all the way up to $30,000 or $35,000. That is for one single set of teeth.
That's what I was gonna say.
Thank
Yes,
you. Yeah.
yes, good
So
job.
one
yeah.
single set. So 20 to 30,000 for the top, and 20 to 30,000 for the bottom. If you have
Yes, sir.
2 sets. Yeah.
Yep. Perfect answer. I
Thank
love
you.
that. All right. So this question says, "Hello, doc. What does a complete dental checkup cost?"
So the complete dental checkup cost, and I wish you were in the Dallas-Fort Worth area here, and I would say, oh, the complete dental checkup does not cost anything, because
Yeah.
that's what we do.
It's free, 30 free.
Yeah, yeah, ToothHQ, right? At ToothHQ, we offer a dental checkup completely free, and also our complete dental checkup comes with a free CT scan also, or like a CAT scan, that 3D CAT scan, even better.
Yes.
So, but anywhere you go to, any dental office you go to, a complete dental checkup involves checking your teeth, checking your gums, and doing a complete oral exam and a complete oral cancer screening. Either you do a complete set of small x-rays, or you do like what we call it as a panoramic x-ray, or you do a CT scan, depending on which part of the world you live in, or which part of the US that you are living. Sometimes you get like a free exam. You sometimes you get like just have to pay for the just the x-rays. To If you have dental benefits, most of the time these are going to be absolutely zero cost to you. So it is going to be covered under your insurance benefit. The exam, which also comes along with the x-ray, it will be covered by your insurance. And then if you do not have dental insurance, it can range anywhere between zero all the way up to maybe up to even up to $200-300, because some offices do charge for the CAT scan, which we do not here. It can cost all the way up to about $200 to $300.
Yes, that is very true. So it can be kind of expensive to do the exams. However, like Dr. V said, here at ToothHQ, we do not charge for that. So if you are around here, we would absolutely love to have you and be able to, cater to your dental needs.
Fantastic. Thank you.
Yes, sir. So this next question does say, "I had my upper wisdom teeth removed when I was 21 with no pain or complications. My lower wisdom teeth were impacted, requiring an oral surgeon and a ride home. I followed all instructions but still got a dry socket, and which was quickly treated. 30 years later, I broke tooth number 14 while eating a frozen Snickers bar. After starting antibiotics, I had it extracted despite using ice packs, ibuprofen, and saltwater rinses. I'm still in pain 3 days later. My left sinuses are acting up, and there's a strange drainage from the socket, possibly pus. I have dissolving sutures and am on a second round of antibiotics until my follow-up. I've been careful, no straws, no spitting, and strenuous activities. I stick to soft foods, chew on the other side, avoid hot and carbonated drinks, and apply clove oil to the gum above the socket. As a nurse, I'm familiar with the healing process. Any advice on this, doc?"
Man, what a wonderful narration, right? It's
Yes,
almost like
yes,
a
very
story,
detailed.
very detailed. No wonder you are a nurse, right? And
Yeah.
so you are in the business of helping patients. And thank
Mm-hmm.
you so much for telling
Yes.
the world what all the things that you can expect. Please listen to her question. Whatever Emily said carefully, she wrote a narrative, right? A
Mm-hmm.
complete narrative.
Mm-hmm.
So the long question short, and she had some previous oral surgery done. She did fine, but now she had an upper left tooth extracted, which we call it
Mm-hmm.
as a number 14, and she's having some issues with some pus coming out of that area,
Mm-hmm.
and she's on a second round of antibiotics. So what we call it as an oral antral communication. What means like oral, which is this. Antral means like antrum, maxilla, right here, which is the sinus here. What she is possibly experiencing is an oral antral communications. If you remember,
Mm-hmm.
that's a class we had. We were
Oh
teaching the dentist last
yeah.
month.
Yep. Yes,
So
sir.
what she has is an oral
And the
possible.
sinuses.
Exactly
Mm-hmm.
right. So what she possibly has is an oral antral communication, which is taking some time to heal, and sounds like the dentist has already put her on the second round of antibiotics. And bingo, 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 she already said she's taking all the precautions. No
Mm-hmm.
straws, spitting, no strenuous activities, and she's sticking with soft diet, and she's chewing on the other side, avoiding hot and carbonated drinks, and everything perfect. She has to do everything. The only thing that I would recommend that you change is, you said applying clove oil on the gum above the socket. I would not recommend
Mm-hmm.
doing so. Whenever the sinus is sealing, I call it as a baby tissue. So whenever you have the communication, the baby tissue or the baby gums are trying to close, then you put oil, then they break open.
Mm-hmm.
They start to close again. You put clove oil, because of the irritation, they will break open again. So I would recommend you do not put the clove oil. In addition to all the things that you already said, few other things that I would highly recommend, which I normally tell all my patients every single time, is don't blow your nose. If you're going to blow your nose, particularly on the side you had the procedure done, it is going to again break the baby gum tissue open. And same thing, when you sneeze, let it go. People have a tendency to hold it. When you hold it, then it's just going to increase the pressure on the sinus, and it is just going to break the baby gum tissue open. So don't blow your nose, don't sneeze, let it go when you sneeze. And do not bend over. When you bend over, you put a lot of pressure. Now the pressure wants to escape. So do not bend over. So when you have to do pick up something, then just sit down. Sit down straight, and then come back up straight, and do
Mm-hmm.
not fly. When you fly, when you're going to build a lot of pressure inside the sinus, and then that is just going to again break the gum tissue open. As you said, no straws, no spitting, no strenuous activities, soft diet, chew on the other side, and do not apply the clove oil.
Yeah. Perfect.
Yeah,
I
and
actually didn't know about the flying.
yeah.
That's something new I
Right.
learned.
And one more thing, and you already said you are taking the antibiotics, and a lot of times, what we also do is, in addition to the antibiotics, we give sinus medications. For example, like Sudafed, which is going to help dry the sinus, because when it helps dry the sinus, it's just not going to have the drainage coming through again to break the gum tissue, the baby gum tissue open. So when the sinus is dry, so the baby gum tissue heals, and stays, and eventually the communication opens. And sometimes it takes about a good 6 to 8 weeks, or even a couple of months. So do not hurry, follow all the instructions, and I know you're going to do it, and now you're going to do it real, to follow all the instruction. Now you're being a nurse, so just do it carefully, and then everything is just going to be fine. And if you do not get better, then follow up with your surgeon, and they should be able to help you.
Yeah, wonderful. Another thing, Dr. V, that I was curious about, you said the clove oil, right? Can clove oil sometimes cause issues like with ulcers and such with
Well,
using
that is
that?
exactly what I was trying to say. Whenever you put clove oil, the clove oil is going to cause some kind of an irritation. So that's
Mm-hmm.
why I was saying sometimes people, particularly overseas, people have a tendency to put actually not just the clove oil, they actually put the clove. So
Mm,
it actually kills the open nerve, and so that
okay.
is how it causes some kind of a damage, or like kind of soothes and makes the nerve die. So you don't want to irritate the baby gum tissue by putting the clove oil, and that's why I said don't do
Yeah.
that. Yeah.
Okay,
Hmm.
interesting. Well, Dr. V, we have some live viewers here that have some questions for us.
Oh, okay.
So we are going to go to them and see what they have to say for today's show.
Okay.
So, question number one, Dr. V, does ToothHQ offer any in-house dental membership plan? That's a wonderful question. You want me to answer
Sure, man. Try it.
it?
Try it. I hope you can get it right.
Yeah.
Let's see whether you can get it right.
Well, so with the in-house membership plan, some offices I will say offer they'll offer like a $300 or $400 monthly plan, right? And that includes like your two x-rays and two types of cleanings, but that's with general dentistry. So we are a specialist, and so with being a specialist, I don't believe, and I could be wrong, so please correct me if I'm wrong.
Right. So what they are referring to the membership plan. Anytime
Mm-hmm.
you go to a dental office and they are going to offer a membership plan,
Mm-hmm.
you pay a monthly fee of like starts up to upward anywhere between about 19.99 per person,
Mm-hmm.
or a family of four, they usually pay about $39 per month. And then you pay an yearly, and sometime when you pay yearly, you get a discount.
Right.
With that plan, with that membership plan, you get two cleanings per
Mm-hmm.
person, and then also you get the free x-rays, and also you also get a discount
Mm-hmm.
on their fee, the dental office fee. For example, if a crown at a dental office is about $1,000, and when you use a membership plan, you get it at a discounted fee of either they will publish the discounted fee as 800, or you get 20% discount across the board.
Yep.
So the question here is, what is Truth HQ? Do we
Right.
do that? We don't have a membership plan,
Mm-hmm.
like Emily said. Most of the specialty offices, as we are a specialist, and we do not offer a membership plan. However, as you know, we do offer a discount. We have
Mm-hmm.
a lot of cash paying patients. We do have a lot of patients with even Medicare. They come in and they don't have the coverage for the specialty procedures that we offer.
Mm-hmm.
So then we do offer a discount, and more than anything else, a lot of people are looking for some kind of an affordable payment plan.
Right. Right.
So long story short, if you're looking to get help for the specialty procedure you need, come to us,
Mm-hmm.
and we don't charge for a consultation fee or a CAT scan. Your initial consultation is 100% free.
Right.
And as you come in, we'll talk about whether we can offer you a discount, or whether we can give you an affordable payment plan to help you.
Yeah. Wonderful. Thank you,
All
Dr.
right.
V.
Perfect. Yeah.
So the next question that we have, let's see here.
Yeah. Okay.
Is going to be, could you please provide guidance on what to do if a nerve injury in the jaw and tongue after wisdom tooth extraction wasn't addressed promptly? 2 years ago, I experienced the issue, but my doctor advised me to wait, saying it was nothing. Now, a specialist has informed me that it's too late for innovative treatments for CB or CBT therapy, and to accept the permanence
Mm-hmm.
of the condition. Is there anything else I can do or consider at this stage?
Um, unfortunately, when you wait too long after any type of nerve damage, and the nerve damage becomes permanent and you really can't do anything. Just like you visited the surgeon said you waited too long, there is nothing can be done. And I'm sorry about the situation you may be in, and I'm not sure what type of miscommunication there was with the previous dentist that who was involved in the treatment, whether they said something, there was some kind of a miscommunication. um, but anyway, at this point, you really can't do anything. You can definitely consider seeing a neurologist. And although the surgeon might have said they may not be able to do any type of surgical procedure, there is still some kind of a medical treatment if you are experiencing some type of pain, or what we call it as a neuropathy or a nerve pain. um, you may be still be eligible to get some kind of medication. So my recommendation would be talk to the surgeon that you already told you that you may not be a good candidate for a surgical procedure if you are experiencing any type of symptoms other than the numbness, which may not be reversible. If you have any pain or any other type of symptoms uh, that are treatable with medication, your surgeon should be able to recommend some type of a neurologist, or even your surgeon will be able to give some kind of a medication. uh, but again, long story short, anytime you are going to experience any type of numbness after any type of dental procedure, 6 to 8 weeks is the longest that we leave. So after 6 to 8 weeks, and if you're not getting any better, the referral has to be done immediately to what we call it as a neurosurgeon, or even better, like a microneurosurgeon. So the nerves that you have in the mouth, or particularly in the jawbone, are they a very, very tiny nerve. So in our office, in if any patient we see that they happen to have any type of nerve damage, that we got a referral from other dentists, we cannot treat them here, so we have to refer them to these microneurosurgeons. So wherever you are, talk to your dentist and see whether you can be referred to like a neurosurgeon or a microneurosurgeon if you happen to have any type of nerve damage, and do it 6 to 8 weeks after the procedure.
Yes, wonderful.
Mm-hmm.
That's a wonderful question as well.
Thank you.
So let's see here. What is the price for dentures with 2 gold snaps on both the top and the bottom?
So what they are referring to is anytime you have missing teeth, you have two options. One, you can have teeth like this, which are what we call it as a removable denture. This is the top right here, and then this is the bottom here, right? That does not snap. This is like what we call it as a grandma denture in our office, and I'm sure you probably have seen your grandma or grandpa having these dentures, but they don't stay in the mouth and they stay in a bottle because they don't
Right.
stay. Particularly the bottom ones, you have a denture and you have your lip, it wants to fight with it and push it in, and your tongue wants to fight with it and then it wants to push it out. Now both the tongue and the lip fight and the denture pops out. So this is not a good situation. So to prevent this from happening, what we normally recommend, you get what we call it as a snap-on. This is what this is the gold snap-on the caller is talking about here. So what that means is you get some implants, and we put some button-like attachment, just like a shirt button right there. So you just snap it on, right? That's what is the caller is talking about. To answer the question about the cost on these two snap-on, they start anywhere between about $7,000 and up. Okay, so $7,000, and as long as you don't need any type of bone grafting, can you get by with two on the bottom and two on the top? Absolutely, yes. Talk to your dentist or the surgeon, and they should be able to help you.
And once again, the $7,000 and up is per arch, right? So it would be per upper and lower.
Yep, correct. Yeah.
Yep.
Well, 7,000 per arch. Yeah, you're
Yep.
right. Absolutely
Yes,
right. Yeah.
sir.
Okay.
Alrighty. So we have some questions for you, Dr. V, that you have to think of on the top, on the spur. So you gotta be quick, quick, quick for me.
What do you
I'm gonna,
call them?
I'm gonna test you. I'm gonna test your knowledge.
Okay, man. All right.
Rapid fire
Rapid
questions.
fire. Okay, so we
Yes.
introduced these rapid fire round like a couple of 3 or 4 shows ago, and they've been very popular. So we are going to
Mm-hmm.
just answer quick like that. Okay,
These are
I'm
my
I'm hoping.
favorite.
I'm hoping, because some question I see like they're very long here. Okay, all right,
All
go.
right. So question number one, Dr. V, is sugarless gum healthy for teeth?
Absolutely. The sugarless gums are healthy for your teeth for a variety of reasons because they increase saliva production, they reduce the plaque acids, and then they also help with the remineralization of your teeth.
Really? I did not
Mm-hmm.
know that.
That's right. Yeah.
Okay.
Absolutely. Yeah.
So chew sugarless gum over sugar.
I got it. You got it, man.
All
Yeah.
right, the second one. Which lasts longer, veneers or crowns? That's a good
Uh,
one.
Absolutely. So, hands down, the crowns last longer
Hmm.
because veneer is like a facing that just sits over the top, as
It's like
opposed to,
acrylic,
there we go,
like
bingo.
nail,
I
lemon
know you're
nails.
gonna do that. I know you're gonna do that. Yeah,
Yes,
yeah.
yes.
So they sit on the top of surface of the tooth, as opposed to a crown is almost like grabbing onto the tooth like this. Yeah.
Hmm.
So it's almost like a jacket, right? So it
Hmm.
definitely lasts longer. So
Yes.
veneer crowns, as opposed to veneers, crowns last longer.
Yes, for sure. All right. Will using interdental brushes help prevent gum disease and cavities?
Absolutely, yes. So we always recommend anything and everything that you can use to help prevent the gum disease. In addition to brushing and flossing would help. In our office, we highly recommend patients use the interdental brushes, or we call them go in betweens, to prevent gum disease and cavities.
Okay, perfect. All right. Is a tongue scraper more effective than brushing my tongue with a toothbrush?
Absolutely, yes is the answer. The tongue scraper, I don't know how many of you guys seen it. Just Google it. It is almost like a plastic, and then you put it on
Mm-hmm.
the tongue, and then you just
Yep.
scrape your tongue. You do that, as
Mm-hmm.
opposed to brush. It's as effective. I've used both of them, and the tongue brushing the tongue with your toothbrush is as effective.
Mm-hmm.
But the tongue scraper is a tad better, and I've seen even people, scraping it so hard the tongue starts
Mm-hmm.
to bleed. So,
Mm-hmm. Make
mhm.
sure it's clean.
Yeah, you got it. Yeah.
And then we have a question here. Are toothpicks, as the name suggests, safe to use on the tooth?
Well, as the uh, as the name suggests, like you pick on the tooth, right? It may
Mm-hmm.
seem like a handy tool. Sometimes they may cause damage if they are not used diligently. If you are going
Mm.
to use it and then just once and then throw it away, it's okay. Although
Mm-hmm.
we don't recommend, because we recommend doing flossing. If you don't use them properly, they can cause gum damage, tooth damage, and they can break, and then they can become a splinter, get lodged in your
Oh,
gum
yeah.
tissue, and when they get lodged in the gum tissue, they can cause infection. So my
Mm-hmm.
recommendation, which are the safer alternatives, as you know, we do it in the dental office, use a dental floss, or like the previous question, use the interdental or the go in betweens, or even interdental, the water flosser. So those
Yes,
are
water
the
flossers.
safer alternatives
Mm-hmm.
as opposed to the toothpick.
Yeah, well, wonderful.
Great.
All right, Dr. V. Let's see here. It says, "Hello, Doc. It's been 11 days since my wisdom tooth extraction, but my lip and chin area are still numb and a bit painful when I touch them, as well as my front tooth. Will this get better or is this permanent?"
So, if you have been experiencing some kind of a numbness, and I don't know whether you are completely numb, or you're having some kind of a tingling sensation, almost like an electric shock, right? So whenever you touch, like it just kind of goes like a shock. So, if you're completely numb after 11 days, like I call it as a dead, like a rock. That's what
Mm.
I say. So, if it is like that, then I will be a little bit more concerned. And pain it is going to get better. I'm not too much concerned about, I will not be too much concerned about the pain. But on the numbness, if you're dead like a rock, again, I would be concerned. But if you're having some kind of a tingling sensation or like a electric sensation, then hopefully things are going to get better. My recommendation is if it is 11 days out, it should not be like that, or you should have contacted your dentist by now to ask them what is going on and whether they are going to recommend, or whether you are a high risk patient, right? So if you're a high risk patient, and more than likely you probably had a discussion with your dentist or the surgeon about the risk involved in this. So my recommendation is talk to them. And in the early stages, if it is within 11 days, we give you sometime we give you the anti-inflammatory such as a steroid dose pack, or we also put you on a regular anti-inflammatory like the Advil prescription strength medication to reduce the inflammation. And also we give you vitamin B. We give them in prescription real strong doses, vitamin B12. The vitamin B has been shown to increase nerve regeneration. So we put them on the early stage, so that really helps you. So again, long story short, talk to your dentist after 11 days. If you're completely numb or if you're tingling, I would still recommend talk to your dentist and they can put you on some medication.
Yes, for sure.
And if it lasts longer than 6 to 8 weeks, and talk to your dentist about possibly getting referred out to like a neurophysician or a neurosurgeon.
Yeah,
Mm-hmm.
wonderful. Thank you for that. Hi, Dr. V. I've had 2 root canals done on the same tooth in 2015, and now, after 9 years, I'm experiencing pain again. What could be causing this, and what should I do next?
Well, if you had two root canals on the same tooth in 2015, more than likely, it's almost like 10 years out,
Yeah.
so they probably lasted enough time, and they probably 10 years is a good time, definitely after a root canal. Although we say root canals are like a ticking time bomb, you never know when they are going to explode. So if they lasted for 10 years, which is a good time, and if you are experiencing pain, then possibly there is some kind of an infection or the tooth completely cracked. So there is nothing much you can do at this point, other than again you can go to an endodontist to see what could be causing that. If it is infection, if it is treatable, then if your endodontist feels comfortable redoing a root canal third time, I highly doubt it. And if your gums are healthy, and if it is treatable using what we call it as a re-root canal, or like possibly sometimes we call it as an epicoectomy, which we section the end of the root. And if it is possible, then your endodontist will be able to tell you. In my personal experience, and if you have done it once and if you have already done it twice, and the second one lasted almost for 10 years, and what are the odds of the third one lasting? Depending on your age and how young you are, my recommendation would be to consider, particularly if you have any type of gum problems in association to the root canal issue, my recommendation would be to get it out and then replace it with a dental implant. Nowadays, dental implants are very safe and they're very predictable. And as long as you take good care of them, they may end up lasting for the rest of your life, as opposed to redoing the root canal again. Again, you may need again, you may need the tooth to be extracted in 5 years and have the tooth replaced with a dental implant. So
Right.
my recommendation would be to consider the dental implants.
Well, wonderful. Thank you, Dr. V.
Mm-hmm.
Dental implants, they are amazing. So, Dr. V, we actually have another live question from our viewers.
Mm-hmm.
So, let's go to that and see what they're saying.
Mm-hmm.
So, our live question is, I had all 4 wisdom teeth removed in 2020, and I accidentally stabbed one of the extraction sites with the cleaning syringe. Since then, it has been painful and feels numb. but my dentist says nothing is wrong. What should I do?
Well, if you're feeling numbness, if you're feeling numbness and pain, pain obviously can be treated with either some antibiotic or pain medications. And if you absolutely feel that the numbness started after you stabbed, it's kind of hard for me to tell you what exactly is going on, where the numbness is, and if you have some numbness just in the area that you stabbed, then more than likely things are going to get better. I'm not too concerned about the pain because we can obviously treat the pain depending on whether you have a dry socket or you probably have some kind of a bone spur sticking out. Based on that, we can very easily treat the pain with the multitude of treatment that we can offer. But as far as the numbness, again, if it is just from the stabbing, I don't see it as a problem at all. It could get better. It is going to get better. Again, without seeing you, I really can't tell you what needs to happen. My recommendation is you talk to your dentist and see what can be done, and or talk to your dentist about possibly getting referred to like a surgeon, and if you're too concerned and if you're not getting the right answer that you need.
Yeah, wonderful.
Mm-hmm.
Sounds great.
Yeah.
All right. So we have another question here for us. Now, let's see here. I read that fluoride is a waste byproduct, specifically hydrofluorosilicic
Yeah.
salicylic
Mm-hmm.
acid, and that it's a carcinogen.
Carcinogen.
Carcinogen. There we go. Thank
Yeah.
you. That damages bones and teeth over time. It's said to be a toxic poison, even in small doses, and can stain teeth and kill germs due to its toxicity. Is this true?
Well, I can tell you it is a myth for sure because you can go online and read about fluoride, and there is a lot of misinformation about fluoride being a toxic material.
Mm-hmm.
Although in the healthcare world or in the dental world, we always say fluoride, as you guys know, it is a mineral. It is in your drinking water,
Mm-hmm.
right? So it is a safe mineral. People have been drinking water with fluoride for thousands and more than thousands of years, and it's not a problem at all. And I can tell you, fluoride is not a cancer causing agent. Fluoride is not a carcinogen. It has not been shown in the medical literature to be a carcinogen. I would not recommend you worry about that. Fluoride, the reason we give people is because it strengthens the tooth, and we have also known that the fluoride also strengthens the bone.
Yep.
And the amount of fluoride that you're taking through the water is like it's a very 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 small dosage, and it cannot be a poison at all at the small dosages that are being tested. Actually, all the cities have regulations that how much of fluoride is supposed to be in the water. And I treat patients here all the time. They work for the city, and
Mm-hmm.
I talk to them because we know about this. I ask them how diligently they test the fluoride content on the water. And most of the cities have this is mandatory. They are supposed to be publishing the data on the city website. So just check it out and see whether how safe is the water in the area that you live in. And one of the other things that we also say is the fluoride kills the germs, and just like you said, it kills it, but you think it is a poison, which we do not think.
Mm-hmm.
But fluoride is kills the germs, and that's why we add them on the toothpaste that all the companies that they make. They add the fluoride onto the toothpaste, and then in very high amounts, and we see that fluoride can possibly stain. Although there are multiple reasons why the teeth get stained. People smoke, and then they may have high bacterial content, and then they may drink a lot of coffee, all of those things. And relative to that, fluoride staining the teeth, I'm not too concerned. We see patients all the time and we do not see more of a concern from the fluoride. So,
Right.
long story short, I would not recommend you be concerned about the fluoride in the minimal amount that you may be getting from either from the toothpaste or from the city water.
Perfect. Thank you, Dr. V. All right. This question says, is laser gum treatment suitable for all patients, or are there specific cases where traditional methods are more appropriate?
The laser gum treatment is suitable for, it used to be, sorry, let me back up. So the laser gum treatment is absolutely suitable for every single patient that we could see, and depends on how we are going to use it. That's what is going to differ. So laser treatment offers a variety of benefits, and so when you have a healthy gum, we use the laser to reduce the bacteria.
Mm-hmm.
When you have maybe like a moderate disease or a starting beginning of gum disease, and we use the laser to decontaminate your gums. And when you have advanced bone disease, when we use the laser to reconstruct, or what we call it as a regenerate the bone and the root surface, the surface of the tooth and the gum. So the laser can be done. The laser can be used for a variety of reason, and to answer the other parts of your question, is it more appropriate to use the traditional methods? Yeah, sometimes we may see the traditional methods may be a slightly beneficial as opposed to the laser gum treatment. But sometimes what we do is, if we really see that the traditional treatment is going to be beneficial as opposed to the laser treatment alone, then we use the laser as an adjunctive treatment. So long story short, laser can be used in any and every part of the gum or the periodontal procedure.
Well, thank you, Dr. V. So we do have another live question that came through from our viewers.
I heard the ding too, man. Yeah.
Oh,
Mm-hmm.
see there?
Yeah.
All right. So this question says, I reside in Duncanville and would like to know what kind of emergency dental treatments does ToothHQ Cedar Hill offer? That's wonderful because we're right there. We're
Mm-hmm.
not too far.
Absolutely. So I think you pretty much know what a dental emergency could be. Most of the time when we get a dental emergency, people we get mostly for the pain. So anytime you have a pain, either the tooth completely broke, or patients have wisdom teeth, the food got like stuck in there, and somebody like earlier said, like the tooth, like they were using a toothpick, and then they got a splinter, got stuck in the gum. And so variety of reason: pain, swelling, discomfort, tooth breaking, gums being swollen, um, and the tooth completely broke at the gum line. So those are all the things, that the swelling of the face, and then
Oh, yes.
yeah, swelling
Yeah.
of the face, and then patients cannot open their mouth wide, and those are all and then another thing is a hot tooth. Now they just absolutely cannot bear the pain. So those are all the kind of emergencies that we offer treatment at ToothHQ. And if you happen to have any of those conditions, and call us anytime, and we are here to answer your phone anytime during the business hours, and then we answer after business hours
Oh,
as well.
yes.
And we can get you real quick if you happen to be in the Dallas Fort Worth area, because we do have 4 locations to serve our patients.
Yes, and we also do walk-ins too.
Absolutely, yeah.
So
Thank you for
any
mentioning
time
that.
that you are around, we would love to be able to have you to be able to treat your dental needs as we stated earlier. So don't be afraid to stop by. We are here.
Fantastic. And if you know, you may have an emergency sometime.
Mm-hmm.
The emergencies, you may be taking some pain medication like Advil or Tylenol, as you can normally do. And if you want to be seen as soon as possible, you go to our website and then make the appointment, and we are going to
Yep.
get you in.
Very
You know,
quick.
we don't have like a long wait because we have multiple locations to serve you guys, and
Mm-hmm.
we can get you in as soon as sometime on the same day, depending on whichever location has the availability,
Yes.
or even the next day. And then
And
we do offer same day treatment.
yes, we do. We've
Yeah.
got wonderful girls that would be able to help you through your treatment process. And we've got Dr. V and other wonderful doctors that do same day treatment to get you out of pain. That's our number one goal, is to make sure you're comfortable and no pain.
Speaking of that, how many same days did you do? Yesterday or today?
Oh my goodness. Yesterday we did at least 4 at one location. So we do them all day, every day, multiple times. So we are here for you. That's the biggest concern, is getting you in.
Didn't you stay late yesterday?
Oh,
Yeah.
sure did.
Yeah.
Well, sometimes we're here till 7, 8 o'clock at night, making
You
sure
got
that
it.
we get you out of pain.
You got
So
it.
we absolutely love our patients, and we will do whatever it takes and whatever's necessary to make sure that we make it happen.
To get you out of pain.
Yes, absolutely.
Absolutely, we can do that. If you have pain,
Where are your guys? Where are your people?
Tooth HQ. You got it. You got it.
All right, Dr. V. So there is a question that we have here that says, "Hello, Dr. V. Is it possible for a dental implant to cause nerve damage?"
Absolutely, yes. A
Mm-hmm.
dental implant can cause nerve damage, and I'm hoping that you are asking the question before you get in the dental implant, or
Yes.
you already have nerve damage. I don't know. So, to answer your question, can a dental implant cause nerve damage? Absolutely.
Yeah.
Whether you are a high risk or not, that you need to talk to your implant surgeon, whoever is going to be placing the implant. You know, complications happen for any procedures, right?
Right.
You know, so that you do. A dental, one of the most common complication of the dental implant, particularly when you're having it done on the back teeth, on the lower bottom back teeth, is the nerve damage. So
Mm-hmm.
talk to your dentist and then see whether you're a candidate and whether you need to be concerned about the nerve damage. You know, I've been placing implants for the last about 30 years, and
Mm-hmm.
you know, the chances of nerve damage happen is very, very unlikely, as long as you plan it carefully, right? So
Right.
that's not a problem at all. So talk to your surgeon, and they should be able to instruct you. But if you already had nerve damage from the dental implant, that's a different story. Again, you need to talk to, again, the implant surgeon about how that nerve damage need to be treated. Okay.
Yes, very important.
Mm-hmm.
Nerve damage is very important.
And early treatment is very
Yes,
important,
yes,
right?
yes. You don't want to wait till the last minute. Yep, very much important.
Absolutely, yeah.
All right, Dr. V. It says, "Dr. V, I'm allergic to fluoride. Are there any natural or fluoride-free alternatives for toothpaste and mouthwash that you recommend?" I will say, Dr. V, I did not know you could be allergic to fluoride.
Absolutely, you can be.
Wow.
You can be allergic to anything.
Very
You can
true.
be allergic to anything,
Very
right?
true.
Yeah. So, but although it is kind of rare, although
Yeah.
right, because if imagine this, right? You know, one of the previous questions, and if you did not have a chance to watch that, was related to the drinking water having
Mm-hmm.
fluoride, right? So the city water having fluoride, right? So if
Yes.
you're truly allergic to, you
You
can be
can't drink the
drinking water,
water.
city water,
Wow.
right?
Oh my
So
goodness.
I'm assuming that you know you may have some kind of a pseudo allergy, or you may be thinking that you are allergic to fluoride.
Yeah.
So I would highly recommend you talk to your physician or get an true allergy testing done to
Right.
see whether you are truly allergic. But no big deal. So if you find out that let's say you're not allergic but you are sensitive to fluoride, there are a lot of alternative options available. You can use a baking soda toothpaste, or you can use a toothpaste made of hydrogen peroxide, and you can. There are some specific toothpaste available for people allergic to not necessarily fluoride, but you know there are some ingredients that are available on the toothpaste, which I'm going to highly to recommend that you check out all the ingredients. So you may not be a true fluoride allergy, but there may be a lot of other substance that you may be allergic to. So that's why I said you need to talk to an allergen, allergy specialist. But anyways, so there are few toothpaste that we recommend. One of them is called Tom's of Maine, Maine, Tom's Toms, Tom's of Maine, which has a completely new natural ingredients, and you can buy them on Walmart or Amazon, and we you can do that. Or there is another one. It's called Burt's Bee, Burt,
Yes.
Burt's
Bird
Bees. Yeah, Burt's
Bees.
Bees toothpaste. Again, that has like all the natural
Yeah.
ingredients. So, and then there is another one called Biotin. I believe that one is better also as compared to. So there are a lot of options available. So check it out on the internet or at your local grocery store, or talk to your physician or the dentist, and they should be able to help you.
Yeah, wonderful.
Mm-hmm.
So there's tons of natural remedies out there in toothpaste to be able to do that.
Mm-hmm.
So Dr. V, I'm 30 and have my wisdom tooth removed, scheduled for this week. How can I avoid getting a dry socket? Dry sockets are not good.
That's right. That's right. Yeah. So I'm glad like you are being proactive. You are
Yes.
thinking, and I'm sure your dentist is going to give you, or the surgeon is going to give you a bunch of precautions and instructions to how you can avoid. So the bottom line is, if you are a smoker, you do not smoke, do not drink, don't use the straws, which your dentist is going to absolutely recommend, and do not use the rinse vigorously. So meaning whenever you're using the mouthwash, which the dental office is going to dispense, and so I normally recommend do not do that,
Yeah,
but
and you don't
instead
swish like.
you don't swish, and you don't swish. Instead you get the mouthwash and then
Lean side to
lay
side.
inside and then hold it for like a minute or two, because people have a tendency to do that for a couple of seconds and spit it out, and you cause dry socket, and then the medication doesn't work, because the way the medication works is it sticks to the gum tissue, the antibiotic mouthwash. So you hold it like that for a minute or two and then spit it out, and then avoid strenuous activity. No exercise, nothing. You can walk gently, but no strenuous activity. And then make sure that you are going to take a prescribed medication. So that is very critical that you do that, so you are not going to have a dry socket. And good luck with that if you are going to have it scheduled for scheduled scheduled for about this week. Yeah.
Yeah. Well,
Hmm.
wonderful. Yeah. And then also carbonated drinks, right?
That's right. Yeah.
Yeah.
Oh, you're right.
So
Yeah. So
carbonated drinks are
yeah,
not good to have either because they create the air bubbles,
you got
right?
it. Yeah. So don't drink. What we meant by don't drink, meaning, thank you, Emily, for reminding that no carbonated drinks, and then no alcohol also.
Yes,
Yeah.
yes.
Alcohol sometimes beer is considered as alcohol
Oh,
too, right?
yeah.
Yeah. So that
Yep.
is aerated as well as alcohol.
That's
It's a double
true.
damage. Yeah.
Yep. Perfect.
Mm-hmm.
So, Dr. V, I had surgery on my lower left third molar 8 weeks ago. 2 days after the procedure, I developed a dry socket and had to visit the dentist 4 times. My healing did not improve, my bone was exposed, and the socket only closed 2 days ago. I am concerned because I still feel numbness and tingling in my chin and front lower teeth. My ear hurts when I sleep on my left side, my gums hurt when I drink tea or any cold liquid, and my jawline is painful. When I do household chores? What do I do?
Man, you got all the complications that we can
Yeah.
think of, right? I'm sorry, I don't mean to laugh, but I'm sorry you're experiencing all the complications. Sound like, you got pain, and then you got your ear aching, you're thinking you possibly got dry socket, you got the numbness on the chin and the lip, um, and then you possibly have bone exposure. You got like all of the above complication that can possibly happen during a tooth extraction, right? So my recommendation is, without seeing, of course, we can't really tell you what exactly is going on. So my recommendation is go see the surgeon, because you got all the complication that we can think of, right? So talk to the surgeon or the dentist, whoever did the procedure for you, based on what they are going to see, whether you need some kind of an antibiotics, or you need a some kind of a steroid, or for the numbness, whether you need to go see like a nerve specialist.
Mm-hmm.
All of those things need to happen. So my recommendation is, uh, follow the instruction they gave you until the time that you go see them.
Mm-hmm.
Take very good care of your soft diet. Do not use the straw. Chew on the side that you do not hurt, and then go see the dentist, and they should be able to help you. Yeah.
Well, wonderful, Dr. V. I have really enjoyed this live show with you. I've learned new things, which is always great because I can share that with my patients and other people outside of the office. So, we will do this again next month, and we will love to see each and every one of you back with more questions.
Thank you all
Have a
so
good
much, and
night.
see you next time.